Sitting here on the side of the table, what we're going to do now is perform a myotomal screen. This is absolutely different than a manual muscle test. We're going to be screening for innervation, and we only are looking for weakness or a difficulty to maintain a position. We do not give these tests an actual muscle grade. Myotomally, I'm going to go through the series of tests that we do, and most often we do these bilaterally as we want to see any differences between left or right. Our first one would be a C1-2. It would be cervical flexion, holding in that position, putting my force through the forehead. The other one would be C3 at side flexion. I would do both sides. C4, shoulder shrug, my resistance would be applied. C5, shoulder abduction. As we get into bicep, you can see, depending on the literature, this can be tested for C5 or C6 as there's innervation from both components. I would do resistive elbow flexion. I can then isolate C6 with wrist extension. I would then move into C7 tricep, holding this position. I can then go to C8, which would be having the patient flex the fingers, try to straighten. And I can also use thumb abduction in this manner for C8. And the last one, T1, finger abduction, trying to squeeze the fingers into adduction on both sides. And that would be our myotomal screen, quite quickly done, to try to see if there's any problems with innervation and or weakness.